to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Be seated, and we will open our commission meeting. Welcome and thank you for weathering the storms to get here. We know some of you have some vested interests that we're excited to be able to hear more about as we get going. Our meeting is going to open today with a presentation from our President and CEO that retires on December 31st and has been with Lakeland Regional Health for 10 years and really helped to transform the direction dramatically of that hospital. And it's hard for me to believe it's been 10 years that have gone by so quickly. But she's going to have a little reflection for us of the past and what is ahead. Dr. Thompson?
Well, commissioners, first let me just start with how kind of you to invite this old dog one more time up to the podium. But it is probably a safeguard. I'm not whining. I'm not asking for anything. That was part of the rules. No, just teasing. Truly appreciate the opportunity to come and share with you and to share with the community. And I want to just start this presentation by really spending a minute to express my gratitude, to the people that brought me here 10 years ago, the board members, the folks that were not on the board but were on the search committee. For me and my family, it was definitely the best professional move and family move we've ever made. We've fallen in love with the community. We're retiring here in the community, my husband and I, and we're truly blessed on a personal level. Organizationally, the community has been wonderful to our organization. You all have been wonderful to our organization. We've met hard problems together. We're in the midst of working solutions forward together, and very grateful. Grateful to our 6,000 team members, our medical staff and our team members. When I'm honored to give this presentation about our advancements, but I'm just one of those 6,000 people, and it's really the heavy lift of the people in the front line, the nurses, the environmental service people, especially this year, more than ever before, that we come to congratulate them and their commitment to our community. So I thought what I would do is to break this presentation out into 4 parts of hopefully of some what I thought could be the most interest for you. One is for you also to get a snapshot of the advancements of what we've seen in our clinical programs over these past 10 years. As much as we've done great work inside our hospital, I also wanted to point out to you some of the great work that we've been able to do in the community outside of the walls of the hospital. And as I already began to say, we would be nothing without our partners. Really want to spend a little time talking about our universities, talking about our physicians, talking about some of our clinical partners. And then last, I think it's an optimistic future, but I think it's a hard lift. I think it's been a hard lift over the last 10 years. Florida is a little difficult to run a healthcare organization too. The lack of funding for the underserved in healthcare presents challenges for us. And I think those challenges will only worsen a little bit. And so I think we've got to be poised for them. And we need to have, the tools in our tool belt to be able to address them. So first, my favorite, we'll start with some clinical programs. There's several centers of excellence that were not here 10 years ago that we are now so proud to be here. And most importantly, we feel so much safer to go to bed at night knowing that we've brought these services to the community just in case any of us need it or any of our family needs it. So our Neuroscience Center of Excellence, a partnership with the University of South Florida Health, has brought us comprehensive neurosurgical coverage to the campus. When I got here, we struggled. We had one neurosurgeon. That neurosurgeon was asked to not practice at the hospital, and we now have 3 full-time neurosurgeons with very advanced skills. You can see by the bottom note, we have the first and only fellowship-trained skull-base and cerebral vascular surgeon here in Polk County as one of those neurosurgeons. That's not to dismiss the wonderful neurologists that come to work with those neurosurgeons, the neurologists at the Watson Clinic, our Lakeland Regional Health Physician Group, but to be able to come together and be the first and only comprehensive certified stroke center in Polk County. The Jack and Tina Harrell Family Institute for Advanced Cardiovascular Medicine, again, something that we are so excited about already on the accomplishments that this program has brought to us, but on the vision of the Harrell family on where it's going in the future. So we were the first and only hybrid catheterization OR lab in Polk County. This allows us to do minimally invasive under fluoroscopic total valve repairs. as opposed to needing total open heart surgery. We are the first and only chest pain center with primary PCI interventions. That's our stent percutaneous interventions in Polk County to be accredited in cardiology. And we are only the third hospital, it says here in Florida, that has the advancement of being able to put into the Watchman closure device into patients that are requiring atrial fibrillation care that's not related to valvular work. This is as good as what you can find anywhere in cardiovascular care. So if you think about what I've said, like if you're laying in bed and perhaps you have signs of stroke, whether our neuroscience program is going to step in and fill that void, or whether our Jack and Tina Harold Family Institute will fill that void, you can feel very safe that if an ambulance takes you here, we are comprehensively looking at that program. Future advancements in the Harold Institute will include more work on our genetic personalized medicine program. This is where we are able now to gene type patients coming in and make better recommendations on pharmaceutical care. We will be advancing our women's program in cardiology. Women's heart disease manifests itself differently than men's heart disease does, and we will be building that program under this institute. And the other one is doing more for heart failure and assisting that to transplant, and we'll be doing that program in partnership with our Mayo partners going forward. Obviously, our iconic flagship building now, the Carol Jenkins Barnett Pavilion for Women and Children, and what that has done for us to allow us to do new care for women and children in this community that we were never able to do before. Probably on this slide, I'd like to just draw your attention to the last slide first. You know, I've talked to you before. Really, the reason for doing this building, as much as it was to do amazing things for women and children, was to migrate the campus to private rooms. When we built the tower, we put 100 new private rooms up. We were able to go back to the older part of the hospital and take down several of those doubles to make them single. I know I've shared with you before, you can't build a new hospital room in America that's not single, and that's because of the infection prevention. It's very strong data that shows you are so much safer in a private room. So it's wonderful to stand here in front of you and say after 10 years, we have now 90% of our rooms single, but we also have kept some able to be up in case we need them for surge. And so not only do we have the advantages of having our 864 beds be 90% single, we have kept some of those double rooms with only one bed in them, but as we saw, if our systems gets truly stressed, as we saw somewhat this year in ICU care, that we'd be able to respond in that manner. But now about the Women's and Children's program. We are a level 3 NICU. Just to give you an idea, that means we can take care of babies that are 2.2 pounds. It's been a wonderful service for this community. I've shared with you before. Sometimes we would have twins delivered at the campus where one baby was 3 pounds and could stay with us, but the other one was 2 pounds and needed to migrate. There were other children in the family. The mother wanted to breastfeed. It was truly a disaster for this family on what they needed to do and not being able to take care of their children here. We also were able to take our emergency department. As you're well aware, we've talked frequently about the size of our emergency department being one of the largest in the country. This pavilion allowed us to separate our pediatric emergency department from our adult emergency department. You'll see later in my update, that has allowed us to do so much more flexibility. We've been able to put a COVID pediatric testing site in that ED for quick, urgent responses to parents that wanted to know if their children had COVID. And it's been a multitude of things that we've done now that we've been able to have that space. The only center for fetal care in Polk County, we had no maternal fetal medicine specialist after Dr. Barrett passed away a while ago. So any mom who had a high risk pregnancy needed to travel to Tampa and Orlando. And so now with our Nemours partnership, Nemours has maternal fetal medicines here and practicing with us. We are the only comprehensive health system now in Polk County that has pediatric subspecialists. When I started, I think we had one pediatric subspecialist in cardiology. He left our community, and now we have over 19 different pediatric subspecialists practicing here from the Nemours group here in the first floor of the pavilion, making sure our children get the care they need, where people are not having to travel to Orlando and Tampa to have that pediatric care. They've been great partners. It's an honor to work with them in that partnership. And again, I just want to give thanks to all of the physicians that work in that area, the Watson Clinic physicians, our physician group, as well as Envision, the pediatric ED doctors. The Hollis Family Cancer Center, again, one of the things I guess I should just pull away and just say at this point, I don't know if you've noticed anything, but we have the Harrell family, the Hollis family, the Barnett family. When I talk about a community that reaches out to support this organization, it's probably one of my personal most pride moments is to see that response. When I got here 10 years ago, I thought it was the most unusual thing in the world that none of our buildings had anybody's name on it. I'd never seen anything like that in my previous 30 years in healthcare. So you can see over this last 10 years, we've really called upon the community, this great community it is, and every person we have called upon has answered, and had answered in big ways that are making real true differences here. You can see our accolades for the Hollis Cancer Center. I know it wasn't a secret. About 5 years into my journey, I did have breast cancer, and there would be no place that I wanted to go for care other than the Hollis Family Cancer Center. It does incredible work that anyone should feel comfortable to using in this community. We've also strengthened our cancer center with our relationship with the Mayo Clinic. I think you're well aware we're part of the Mayo Clinic Care Network. This allows our specialists to have immediate access to Mayo Clinic physicians in Jacksonville and in Rochester for any times that they want a second opinion or if they want a consolidated care plan. And that has been a true value across all of our specialties. But in the cancer program, it has added exceptional opportunities for collaboration and learning. You'll see our accolades. I won't go over to that. It's a lot of firsts and a lot of proud moments for that cancer team to have the awards that we are getting as a community-based cancer center. The Banish Institute for Advanced Rehabilitation Medicine, another program, as I sit in front of you as a trained physical therapist, is so important to me that we were able to offer this. We had no inpatient acute rehab facility in here 10 years ago. At that point, it was under a certificate of need. We were able to win the certificate of need and put the $13 million investment into the 6th floor of our historic district and created the Banish Institute for Advanced Rehabilitation Medicine. Truly one of our flagships now. If you know of anybody that's received care at the Banish Institute, it's probably our most highly recognized patient satisfaction and engagement program we have. That care continues not only from an inpatient, but also continues into our ambulatory environment with a quite large ambulatory environment at our Grasslands campus. And our newest project, one that is, again, kudos to the board. I know I presented to this project to you separately. We struggle keeping up with the amount of patients that have behavioral and mental health disease in this community. Very often we are not allowed to find them services or care for them in our hospital because of a lack of access. So our board approved a $46 million project this year to build the new Center for Behavioral Health and Wellness. This will allow us to not only increase our inpatient capacity from 68 to 96 beds, but also brings a host of outpatient programs, which were sorely not here in the community. Partial day programs, intense outpatient programs, some additional treatment programs. And so we really believe, hopefully, we can keep people from just coming right back into the hospital and right back into inpatients, and we can get them on a pathway of wellness and healing, and we can get them back to work, which is the ultimate goal, to get them to feel productive again as family members and as people in business. So again, that was a lot of primarily what's done at the medical center campus. Let's talk a little bit now more about what we've done outside the walls. Prior to 2010, our physician group, the Lakeland Regional Health Physician Group, was comprised of less than 25 employed physicians. And today, we have 225 providers, physicians, and advanced practitioners, and they're servicing over 25 clinical sites across Lakeland. And just again, we're so fortunate to have the Watson Clinic as another large group in our community. During this time, they have grown as well. So you can see this tremendous need that we've had for physicians was not at the expense of any of our physicians, but was truly what we needed to see. We're very proud that our physician group includes over 20 different specialists providing care to members of our community, and we work hard to serve both the underserved as well as folks who can pay. One of the things we're very proud of, it's a little bit inside, outside, and up in the clouds. With myself having my doctoral work in a PhD in engineering, the digital environment, and that freeway is very excited to me because I think it'll drive continued efficiencies and also improve our level of care. But you can see several awards that we've received over the last 10 years as we've moved forward in our digital environment. So we just earned on our ability to do advanced analytics, what's called Stage 7. You can see we are one of only 11 health systems in the United States. We were the first in Florida to earn a Stage 7 recognition for how we are using our digital environment to drive care and business processes. We've received for 5 years the Most Wired award in hospitals. We have artificial intelligence at the hospital. One of the things we talk about frequently is sepsis. If you have sepsis and it's not treated early, you have a very high mortality rate. We have a sepsis crawler. It's kind of funny, when we gave an interview once, someone actually thought it was like a bug, not like artificial intelligence. They wanted to come back and see a picture of the crawler. But this is a program that's running on top of our digital records, real time, assessing the rate of changes in blood oxygen, in vital signs, and it picks up on the rate of change, notifying our clinicians to step in and go through full sepsis protocol. So countless numbers of lives have been saved on having that trigger and having us do what we need to do. Our community health programs have grown. Our screening programs in the Hollis Cancer Center have grown, but we're very proud of this one particular program, which is our Congregational Health Partnership Program. We currently have over 50 congregations now working with us on health and wellness. I'm very excited on the Fit Church Challenge that had a little bit of an easier time pre-COVID, but actually is being reinvented in a post-COVID world. And then we also were really happy that on the Hollis Cancer Center too, we brought the community together for a walk, run in honor of people who were on the journey of cancer care, and a fundraiser for the Hollis Cancer Center. Partnerships. Hopefully I've reinforced enough to you all the time. Every building we build, we only build because we need the building. And yet the building means nothing. It is only about the people who work in that building that are important. So some of our partnerships, I've talked about some of them. The Surgical Diagnostic Center of Lakeland is a partnership with the Watson Clinic and Dr. Jay Mullaney. The Mayo Clinic Care Network, I talked about how that helps our specialists reach the Mayo Clinic. Talk a little bit more about that. Every computer at the hospital has an icon that says Ask Mayo Expert. That's whether you're a nurse, a respiratory therapist, physical therapy, whatever, you go on there, you can see Mayo's protocols instantaneously. If you are a patient with us and you would like a second opinion from the Mayo Clinic, you can have your specialist send your records to the Mayo Clinic with the question of what care point you need help with. They will send back in 48 to 72 hours a written second opinion that can be shared with you in writing for no additional cost. And so they have been not only tremendous partners to raise the level of care, they've been tremendous partners to assist people when they're really struggling with how to receive their care. I talked about Nemours already. So blessed, wonderful organization, great leadership, great physicians. Radiology Imaging Specialists, it's a large radiology group here in town. All of our outpatient facilities are joint ventures with them. USF Health, we talked about their huge focus with us on neurosurgery, but also Dr. Haight comes to us. And I know through this COVID journey, I don't think there's, Dr. Haight and Dr. Fauci are probably two in Lakeland names that we know for great COVID advice. But Dr. Haight also comes from us from the University of South Florida. He's a professor there in internal medicine and infectious disease. And truly, we would be nothing without the Watson Clinic. Hopefully, we express to them their passion, their commitment, their love of our organization, the love of the patients has truly been, to work with that level of talent has been rewarding to our organization for sure. We're very excited as I get to the end. Danielle has an excellent reputation with their new leadership, and we think that will bring huge value to the organization and the community. What a great place to be a college town. I recently was touring the new president of the Florida Hospital Association at the medical center, and she said, okay, tell me about your workforce, tell me where your holes are. And I'm saying, we have amazing universities. They have responded to our challenge for our nursing incredibly well. Every one of these organizations we have special relationships with. They are doing a lot of clinical programs beyond nursing for us, and I can't say enough about them. In kind, hopefully they say enough about us too. Florida Poly, Florida Southern, Southeastern, we are doing their student programs. Our nurse practitioners are there to support their students. They've taken advantage of our COVID resource center to make sure that everything we can do to make sure as they're bringing their universities up, they're as safe as possible. And Polk State also, we have a wonderful relationship with Polk State. We do not do their student program, but Dr. Falconetti has also made herself a great already leader in our community and a great partner to the organization on all of the programs that are going forward. Just to give you an idea, the flexibility of these colleges have been huge over this 10-year journey. We have a hard time finding medical laboratory technicians. That has happened for a very long period of time. You know, when you're old like me, you can, like, pants get big, pants get narrow, pants get big, pants get narrow. But that started actually with HIV because people did not want to touch blood. And it was so far into people coming into the healthcare environment, so people did not go into laboratory science if they thought they were going to be frontline, you know, clinicians. That has continued, you know, what has that been, 30, 35 years or so? So Florida Southern partnered with us and took their biology majors and other science majors and added additional coursework to allow them to get a degree in laboratory science as well, filling a huge void for us. I mean, a national shortage of every hospital you would ever talk to would say they have that problem. And now we have, you know, the university meeting those needs. Southeastern will be doing a chaplain residency program with them. The Florida Poly, we have internship programs with them to help them, also on logistics, industrial engineering, and IT. So this give and take to the universities to us is something we are so proud of, and we think it poises us to be special because we have these universities, and we're so thankful for their leadership. All right, so a little bit about the future. Well, the future has COVID in it. You were wondering when you were going to see the slide, right? Staying very optimistic. Well, this was our World Series in healthcare. You know, when people would say, you know, how was it, you know, leading through the first phase? And, you know, Danielle and I definitely share that responsibility. And I was just said, well, this is what we've trained our whole lives for. You know, this is our World Series. So hopefully the Rays bring it home next week. But hopefully you see that Lakeland Regional Health really did everything it could to protect this community during this pandemic. Little things from having our resource center up on our website, making sure that everything that we learned as we were on the front lines, as people brought back their businesses, we could share and we could give advice to. The biggest problems in the COVID journey was getting adequate testing and adequate PPE. We have had enough time now to respond in PPE. When I say we, the country in general, some incredible local manufacturers did amazing, like miraculous work for us. But that has been a much more stabilized environment right now. The testing still tends to be really horrendous. Every day we need to look to see what we are able to receive as far as testing supplies, what is the quality of the testing supplies, and how best we can use them. It reminds me, every day, I don't know if you have this with your children, that game where you had to pack up your wagon and try the Oregon Trail and get over, you know, the Mississippi. That's what this was like. It was like, okay, I have 7 Cephioids left. I got 100 Panthers left. I might have a Valator. I might have a Desaurian. Can we get through the day? This was just horribly, horribly managed. And state leadership will say that, and federal leadership will say this. The testing situation was horribly managed federally, which made it impossible for the state to manage it. And it continues today to be just a very, very hard issue. We're trying to do everything we can in that space. Trying to communicate clearly to you if the quickest test that everybody wants is not the best test. That's a very hard message, right? You want to know right now if you have something. Almost all of the quick tests are only 80% correct. Better than nothing, but I'm not so sure that's exactly safe to say you still have a 20% chance. Go back with your kids in school. Go see grandma. It's really been a problem. So hopefully we continue to see improvements in testing, but that has been probably still the legacy of the first surge, has been that for sure. Very proud on how quickly we responded. Our drive-up testing centers, we had a dedicated respiratory care center, we have our pediatric testing center going on. We partnered a great deal with our long-term care facilities. There was times that we housed probably up to 60 positive COVID patients from nursing homes because they were not able to safely care for them and isolate them. And I think the state did a wonderful job with that. Truly, the Agency for Healthcare Administration partnered with the hospitals and the nursing homes, and I think we probably, as critical as I am at testing, I probably think we were the best in the country on nursing homes. And that was great to partner with them on that. And kudos again to our physicians. And as much as we have here our physicians partnering to us to bring back our OR safely, we COVID test everybody if you're getting a procedure now. The teams are safe. You are safe. Do not be afraid to come to a hospital. We are probably the safest place for you to come because we know how to protect ourselves and we know how to protect you. But the nurses were the angels. I mean, I have to tell you that over and over again. These primarily women, in every COVID floor we had, they just put on the garb, they put on the N95s, they put on the face shield, and they just went there. They didn't ask for more money. They didn't ask for hazard pay. We have a wonderful union that partners with us. Other communities really struggled with this. They couldn't get a workforce. And so I think there's something so special about this community and about who we are as people that this amazing group of angels ran there. The amount of deaths we saw in the first 2 weeks of August were so great, we had to bring grief counselors in for the nurses in the ICU. So again, we're prepared. We'd like to not do that again, okay? So hopefully we can kind of wear our masks, don't touch your eyes, stay away from people. The big thing we see is people think they can stay away all the time except when they're eating. But when you're eating with someone, if they're not in your little protected bubble, it's a high-risk event because it's a lot of breathing, and you're very close to people. Oh, I'm sorry. We had so many people from the community donate to us for COVID. Everybody from people sending sandwiches to people providing face shields and masks. I mean, it was amazing. If an N95 hit like a Home Depot aisle, Home Depot gave it to us. And we didn't even have to ask. They would just be delivering it through their supplies all the time. Amazing business and individual support. So I appreciate you. All right, so what do we have going on? We're going to have this COVID going on for a while, so we need to be prepared. And we have flu on top of it now, so get your flu shots. And we're really going to try to do the best we can and weather this. It may not be as dark. If everybody does what they need to do to protect themselves, we could have the lightest flu season we've ever had. If you wash your hands, if you wear your mask, life could be good. When you look internationally, some of the countries in the south, south of the equator have had a very minimal flu time that were in COVID-heavy protection. We do believe this community, as well as the country, should take very seriously the social determinants of healthcare and the disturbances that we see across our minority populations. When you look at our community health benefit, we have shown every year, and we work in this space, that Polk County Black residents do not have the health of Polk County white residents. And we have to really do everything we can to strengthen the education in those communities and the healthcare in those communities as we go forward. The physician workforce shortage is still there. We are very excited to continue to push our graduate medical education program. We believe over the next 3 to 5 years, you will see a kickoff in a large number. We are expecting to bring the 190 residents to the campus probably over the next 7 years. And we received more and more approval to do this. Well, lovely to come back to the commission and speak just about that program at some point. Probably Danielle would love to do that. The Behavioral Health Center does not fix the behavioral health crisis. The amount of adolescent and child Baker Acts, suicide that we are seeing in this community is something that we will have to lift up together and work hard about. And we want to be your hospital. We want to be your safety net hospital. When I talked about that behavioral health project, that program loses $7 million a year. And yet our board said, we need to do it. We'll put $46 million in and we will take care of the community. As our competitors come into this environment in a deregulation, they may not have those boards that love Lakeland as much as our board loves Lakeland and makes those hard decisions. So all of us working together again to protect this safety net hospital going forward, I think will be very, very important. And whether that's advocacy work here or at the county, or at the state or federally to get that accomplished. I think these challenges are just our next version of maybe the Stanley Cup. I said COVID was our World Series. We want to keep winning those awards. There's nothing here that we feel we cannot do with, again, this incredible community, the incredible board, your support. But from my selfish perspective, the reason I think it's going to work is because I am so incredibly proud that our board has selected Danielle Drummond to be my successor. I've had the opportunity to work with Danielle for several years now. Probably the smartest person I've ever worked with. Her, her educational accolades are here. You know, she's her real engineer. I mean, her undergrad biomedical engineering from Washington University, her master's in medical technologies management from Marquette. She worked for GE Healthcare after she graduated with her master's degree. She actually coded for CAT scanners. She has several patents on her own name before she went out and went across GE Healthcare and worked across the country doing projects improvement, being she's a Six Sigma black belt herself. You'll see that the county recognized her, the country recognized her as being one of the 25 best chief operating officers in the country a couple years ago, and she is just poised to partner with you all and do amazing work going forward. I often said if the board had not chosen her to be the next CEO, I wouldn't retire here, and I really meant that. So I'm so excited to see where she and all of you take the health system going forward, and I am honored on January 4th to go bother you all about playing a little bit more basketball at the Y as well. So thank you.
Thank you. Questions for Dr. Thompson from any of the commissioners? Commissioner Walker.
Thank you, Dr. Thompson, for the report, and as always, it's good to have you come before us and share with us the accomplishments of what LRH is still continuing to do in being a flagship hospital in our community, not only our community, but surrounding area. You did mention about the challenge that we have among the black population, African Americans, when it comes to health care. And I know we saw, interestingly, reports about the disproportionate numbers of black and brown people when it came to COVID-19 and that kind of thing. And looking, of course, at the numbers that you just shared with us about, administering, I guess, 52,000 COVID tests and 1,500 COVID positive inpatients that you served, do you feel we've done the best as we could do to make sure that the black and brown population here in our community were tested, were treated? Or do you think there's still some things that we need to get done to make sure? I know you've had your different places available and in the community to make sure people will get by and get tested. Yeah. You open your doors for that. I do know all of that. But tell me, do you believe because of the numbers we're continuing to hear about the disproportionate, situations among people of color?
Yeah.
Have we done that? Have we made sure?
Yeah. That is a wonderful question and has so many squirrels to it, like little wiggle rooms to it. Let me try to address several of them. From a Lakeland Regional Health perspective, we were very careful to make sure when we started our drive-through testing center in partnership with you, it was at the RP Funding Center, which was a good location. When they needed to take back the RP Funding Center, we added our drive-through testing right next to our Family Health Center, which is our indigent care center. So we tried to have sensitivity. The south part of the county was struggling a little bit, and the county reached out and asked us to put Mulberry, and we put a drive-through testing center in Mulberry for them as well. So I think there was access to testing. However, what we find, health runs linear to education. And, a lot of us that are leaders in healthcare actually lobby for education funding almost before we lobby for healthcare funding. Because the issue is just making sure, and that's why we try to go to the churches in that congregational program where people may be more comfortable. We try to use, as much as we can, diverse people in that relationship too, because we know there's an untrusting relationship sometimes of, the majority working in the minority population to do that. Was everybody able to understand at such a rapid rate the warning signs, things to watch for, how to address it? I bet you not. As much as I'd love to say to you, the more underserved community had just as much dialogue as people around Lake Hollingsworth, probably not. I can tell you from watching the Polk County numbers on actually positive patients that we did not have that many positive, black, Latinos compared to white, but I don't want to say that to you give you any comfort. Perhaps we weren't testing enough in that community. when we looked across our deaths at the medical center, we did not see a racial bias to the deaths population-based. So I can tell you that why. We treat everybody the same, every pathway, every access to plasma, every access to any of the drugs the same. I can do that. But I don't think our work is ever going to, I don't want to say ever. We're not starting at an equal platform. Like, we have to really work at having our Black communities and our Black residents have access to the education and the health care, and having their families supported in order to get them to understand that. You see it now, having on the internet, not in all of the communities, having parents that aren't comfortable using that technology to help their children. We really have to create more resources around them, not just for education, but also for healthcare. So I think we did, and we definitely did not do a biased job. Did we do enough? In the midst of the craziness, all hands were on deck because we had so many ill people so quick, and the ICUs were getting stressed. I think your question is a really good question, because I think I can go back to my office now and say, how can we do better? How can we do better now that we're not in a surge to go out to the Black communities? And I'll take that forward.
Well, I appreciate that, and I know even talking with Mr. Spate, and I see him in the audience, I want to tell him thank you for taking my calls. Number of calls I would make, and he and I would share to try to make sure that we were doing what we could do.
Yeah.
Because you get reports, I'm not saying every report is the right report, but it's what media is put out there, and you want to make sure what's there is correct. So it could be, if it's the right information, how can we best make sure we take forward whatever we can do as a city, as a commission, as a mayor of our city to take care of those situations at hand. So I would say thank you, because I know when I would make the calls, Mr. Spade will answer the call, and he would say, well, hey, Phil, let's see what we can do to make it happen.
Yeah. I can assure you that CARE is never biased, but can we do a better job on outreach? We will take that back.
Well, I'm glad to know you plan to make some more headway to help support moving forward. I appreciate that.
Absolutely.
Before you leave.
Yes, sir.
And even
I
after.
have some time.
Other questions? Commissioner Reed and then Commissioner.
Thank you. Can y'all hear me okay? Good. Lane, that's a quite impressive presentation today. It's really good to know that our citizens, no matter what type of affliction they encounter, that we give them, all of our citizens, opportunity for the best health care available. And it looks like we have the highest standards around from what I'm reading your stuff. And again, I'm proud you've been here for 10 years. You've done a great job. Sorry to see you leave, and I'm sure I hope for Danielle will carry on. But I just wanted to make that brief statement, and thank you.
Thank you. Yeah, our work is not done. We're very proud of these accomplishments, but we all know, we have a lot to do going forward on still making sure that no matter who comes to us gets that perfect care. But thank you, and I will pass that on to the team.
Commissioner McLeod.
Thank you, Mr. Mayor, and thank you, Dr. Thompson, for being here today. Similar to what Commissioner Reed said, I want to thank you for your leadership of our hospital the past 10 years. It's encouraging to be reminded of the progress we've made, of all the things that have happened, and how far I think Lakeland Regional has come in the past 10 years. You mentioned some of the things in the future, thinking about the next 10 years and some of the challenges, from physician shortages to health disparities, behavioral health needs. And as we think as this body about quality of life, and the quality of life being as strong as our healthcare system that we have here locally, are there things that you see as additional challenges that are on the horizon that we will face in the future?
Well, let me do one particular challenge that the slides don't cover, and then let me talk about something that I'm really super, super excited about that I barely mentioned. We really are worried about cybersecurity. I mean, we are incredibly focused on cybersecurity right now. One of the large hospital systems in the country, university health systems, got hacked, got held for hostage, several days of not having access to any of their clinical EHRs. So, they're not disclosing how many Bitcoins had to get paid to get the key to get released that. So something on our worry list is definitely, we are increasing our infrastructure staff. And that's a huge issue. I shall leave it like that. We are right now doing a lot of drills on what happens if that EHR system goes down, because realize everything is tied into it right now. It is not just a paper chart and then you have a clinical chart. All of your monitors, everything is feeding in that. It's feeding the crawlers. It's feeding everything to do that business redundancy kind of thing. We have outstanding executives in IT that, kudos to them. Stacy Bolton leads our security and our infrastructure team, and he is an outstanding person. But I think, it's like, I have a son-in-law who works for Microsoft, and there's, like a blue team and a red team, and the blue team writes the code, and the red team tries to crack the code, and once they crack it, they switch positions. I said, George, who always wins? The hackers always win. Yeah, it's just a matter, you can't build the code safe enough until that goes forward. So that's a concern, and we are working aggressively on that. The opportunity, and again, we just are dotting some I's and some crossing some T's, and Danielle would love to come back probably and share with you about the graduate medical education. We think that is such a game changer. As we've worked on state and federal funding, if they can fund 190 doctors that have already had their medical degrees, they will be here for specialist training. We can put them out into the community, at the medical center. Commissioner Walker, what a wonderful way to really teach residents how to handle the problems going forward. We are building their curriculum that says not only do they need to do medical reformation, they have to work on social. We love to see some models where they will adopt a family maybe for their 3 years they're there and watch that employee's health, that family's health, and to get them more involved. I think the biggest opportunity we have is we just can't have the haves and the haves not when it comes to health. If we don't give everybody access to health care, it becomes very expensive when they get sick. I've said that all along. If you don't let people get preventative colonoscopies, and the only time they come is when they have full-blown colon cancer, well, that's $1 million by the time you get through all the care and all the surgeries and all the chemo and the radiation, where just have people have access to colonoscopies. So to get everyone covered with some form of health care is probably the best thing we could do from a country perspective to raise it, and again, to just really work on education. But for our local community, I think getting these residents here, because we don't have the ability to put 200 people out in the community. We don't have those funds. But if we can work and get those residents out there, I think it'll be a game changer, and I think it'll be wonderful for the universities, that we could do partnership programs between our residents and the universities. I think it's going to raise our academic lift from a community a great deal. We're very excited about this program, and we'll be able to do much more announcements about it probably within a month.
That's great. Thank you.
Thank you. Great question. Any other commissioner comments? Commissioner Franklin.
Dr. Thompson, thank you very much for your report today. I can't believe a decade has gone by. I'm not sure where it all happened, but
Sometimes it seems fast, and then sometimes it seems really long.
It says 2020.
Like this year probably seems like 5. That's what COVID does to you.
But the mark of true leadership, and you've displayed that from the moment you got here, though, is leaving the organization stronger than you found it, and you certainly have. I was always concerned, where are we going to turn after you leave? And the other mark is building and developing a team that is able to carry the organization to the next level. So I'm encouraged by that. I'm confident that that'll happen. I do have, kind of picking up on something Commissioner Walker was talking about in the role of education with our citizenry. I've spoken to a number of our health insurance companies who have seen a trend during COVID of claims going down because a lot of preventative care hasn't been happening. What can we be doing to get people back out there and encourage them to get those preventative tests that they should be taking?
And hopefully you heard my little commercial, when I was giving my presentation. We are safe. We are probably the safest place you ever could go. We know how to keep you safe from getting something. It's very difficult. People are just very scared of COVID. They're very scared of a hospital having other COVID patients in there, and they may not be there. You might see some of the systems that have a lot more money than we have putting a lot of commercials out saying, we're ready for you, we're safe, we're, do that. We don't have the funds to take that kind of media push out there. I don't know what to tell you to do about that, but it is a dangerous situation. We will wind up with a higher mortality rate on cardiovascular disease and cancer post this than possibly even what we will do on COVID because of that fear. And that has been projected in our industry. So I think that's a community knowledge spread, you know, that you demonstrate your leadership in I'm getting a colonoscopy, not more than what you needed to do next week, but it's free for me because I work at the hospital. Our health plan does preventative care free. I'm switching to Medicare, it may not be. But you know, the more we share our stories about, like, I went there, I was fine. You know, I got my cardiac test, especially the things that are cancer related and cardiac related. I mean, do not get the care. I think that's super important. And then, Scott, to the other comment, I know I highlighted Danielle, but I am blessed with the team of executives. We have 4 outstanding physician leaders that are there. We have excellent nurse leaders. Our 2 IT executives are strong. We have, like, Michael and John, our attorneys. Like, this team, my legacy is that team. It is not the clinical programs. It's not any building. If I have a legacy down the road, it will be because of that team and that they came here and they wanted to work together and live here. So really, it's definitely more than one person, and that is really there. Like, you can rest about that too.
Commissioner Madden.
Thank you, Mayor. Thank you so much, Dr. Thompson. I thought, what else could I say to add to all of the kudos? I think we're so effervescent up here with praise for all of the things that you've accomplished and the legacy that you're leading. And you know, you mentioned teams and sports a lot, and I just really appreciate the partnership, even with the Lakeland High School Dreadnoughts. Being able to wave at the cancer patients in the pediatric ward was such a thrill. And you know, I kind of think about, you know, you're talking about the great team that you have, which requires a great coach. And we have a legacy coach at Lakeland High School, and Coach Castle. And I think that people would have the same kind of sentiments and feelings about your leadership and your coaching of the team that you've created. And it's just been tremendous, and we are so grateful, you know, for all that you've done. So I just wanted to give the kudos, and I wanted to say I was really happy to hear that you feel like the behavioral health is still on go. I was worried, you know, like we have had to make a lot of cuts here from a city perspective, that might be something on the chopping block, but it sounds like that still is going forward.
Yeah, the board actually, we had to put it on hold during the first surge because you just didn't know how that was going to go. And the board actually pulled themselves back together again in August. We looked at all the numbers, looked to see where we were from a financial perspective, and it allowed us to go forward. So we'll ground break probably in October.
Great. Thank you so much.
Well, I will pivot off of Commissioner Madden and say that I have spent hundreds of planning hours with Dr. Thompson over the last decade.
And you didn't say painful planning hours.
And inspiring planning hours, because she's 3 people in one person. She is the most incredible CEO I've ever worked alongside. She has the ability to talk with every level of employee, and she has brought through the thread of all those things you saw listed in a 10-year period of time because of that remarkable leadership. And so we want to give you a standing applause. Thank you. Okay, thank you very much. We are now going to bring up our Assistant City Manager, Cologne, to be able to do the reaccreditation award from the Accreditation Council of the American Public Works Association. And so she will come up and use this very handy portable mic. So I'll take off mute.
Hello, all right. So I would like to get our Public Works team up here. This award is for all of you guys.
I think so.
I think it's on. And there's the, yes it is. I can hear you now.
So the Lakeland Department of Public Works achieves the American Public Works Association accreditation for the 2nd time. The Lakeland Department of Public Works has recently received it from APWA. The accreditation formally verifies and recognizes that an agency is in full compliance with the recommended best management practices set forth by the APWA. Open to all government agencies with responsibilities for public works functions. Initial accreditation from APWA is a 4-year period during which time semi-annual updates are required to demonstrate continuing compliance. After that time, there's a reaccreditation process which builds on the original accreditation encouraging continuous improvement and compliance with newly identified practices. The purpose of accreditation is to promote excellence in the operation and management of a public works agency, its programs, and employees. Accreditation provides a valid and objective evaluation of agency programs as a service to the public and the profession. Lakeland was formally awarded this prestigious accreditation by APWA's Accreditation Council for the first time in March 2016, becoming the 111th agency in the U.S. and Canada to be awarded, and only the third agency in the state of Florida. During this second accreditation, Lakeland was also recognized for 5 model practices. Please join us in celebrating this accomplishment of Lakeland's Department of Public Works, who have dedicated themselves to continuous improvement and excellence, and whose mission it is to provide essential services and programs that contribute to making Lakeland a great place to live, work, and play.
So you're going to hold this, sir. I'll hold it. And we'll take a picture by staying right there. I'm moving in towards the little one.
Stack them up, James.
Yes, and so can we get a row in front? That's all we've done that.
That's short of me. Okay, so we're moving in more. Does that work for you, sir?
That works. All right, 3, 2, 1. All right.
Wait, Gary, get the Awesome. Thank you, sir. Okay, I am going to read 2 proclamations. The first one is Florida City Government Week. And city government is one with the most impact daily on its residents and is administered for and by its citizens. City government officials and employees share the responsibility to pass along their understanding of public services. The Florida League of Cities and its member cities have joined together to teach students and other citizens about municipal government through a variety of different projects and information. Florida City Government Week offers an important opportunity to convey to all the citizens of Florida that they can shape and influence government through their civic involvement and positively impacting lives by volunteering. So if I could have Commissioner Walker come forward and hold this representing the Florida League of Cities as its first vice president. And we'll take a quick picture. I was going to stay 6 feet apart so that we wouldn't have to have that on if you're good with that. And then I'll hand it to you at a 6 foot distance. Look at that. All right. There you go. Turn it around the other way so they can see that. Yes. Over this way. Coming to there we go.
3, 2, 1.
Thank you very much. Thank you, sir. And then you may have noticed there's some red shirts in this room today. So that is because we're celebrating on October the 19th, World Polio Day. And here to receive the proclamation is Mark Skolnick's Rotary District's governor, by the way, from our club here to come forward, along with Joel Ivey, president, Nathan Dunham, president-elect, Carol Wallace, the immediate past presidents, Daisy Williams, and Gwen Allen, and anybody else who has a red shirt on, come on up. And I'll put my mask on because I'm part of this crew too. Noted by my red tie. Anybody else we could have up?
Go ahead.
Oh, Scott, yes. Thank you, Carol. I'm not thinking behind you. All right, so you get the hold the proclamation now.
Okay, go ahead.
I'll go over here on this end.
All right, can we stack up? Yeah, let's do that.
Let us read first, though, before we do that. Okay, so this is what it's about. Rotary is a global network of neighbors, friends, leaders, and problem solvers who unite and take action to create lasting change in communities across the globe. The Rotary motto, service above self, inspires members to provide humanitarian service, follow high ethical standards, and promote goodwill and peace in the world. There are over 332 Rotary members in more than 5 clubs throughout Lakeland that sponsor service projects to address such things as poverty, disease, hunger, illiteracy, controlling Joel Ivy, and the environment in their local communities. In 1985, Rotary launched Polio Plus, and in 1988 helped establish the Global Polio Eradication Initiative to immunize the children of the world against polio. Polio cases have dropped by 99.9% since 1988, and the world stands on the threshold of eradicating the disease to date. Rotary has contributed more than $2.1 billion and countless volunteer hours protecting the more than 2.5 billion children in 122 countries. Rotary is working to raise an additional $50 million per year, which will be leveraged for maximum impact by an additional $100 million annually from the Bill and Melinda Gates Foundation. These efforts are providing much needed operational support, medical staff, laboratory equipment, and educational materials for health workers and parents, and all because of an originally Genesis 1988 Rotary effort. So this is a very, very high day of celebration. Now we can gather for the picture. We're very intimate.
3, 2, 1. Stay there. 3, 2, 1. You want to do more work?
Everybody smile. All right. Thank you very much.
On behalf of the children of the world, I thank you.
Thank you, sir. Okay. All right, that brings us into the working portions of our meeting. First, we have a Real Estate and Transportation Committee report by Committee Chairman, Commissioner Reed.
Thank you, Mayor. On October 26th, the Real Estate and Transportation Committee met via GoToMeeting. Commissioner Bill Reed, Commissioner Walker, members were present. Commissioner Franklin was absent. Mayor Muntz, Commissioners Madden and McLeod, as well as along with staff, were present. Commissioner Bill Reed called the meeting to order at 8:20 a.m. The order of business was to purchase a 50% interest in 4550 County Road 5540A from Polk County to provide potable water system interconnection. On November the 6th, 2018, the City of Lakeland, City of Bartow, and Polk County entered into an interlocal agreement to provide a 3-way reliability interconnect between 3 jurisdiction water systems for future provisions for water from the West Polk County Wellfield, Lower Florida Aquifer Project. The interlocal agreement provided that the project will proceed beyond the feasibility study should only 2 entities agree to proceed. The City of Lakeland and the county are ready to proceed, and although the City of Bartow would like to proceed, they are not able to fully participate at this time. The design and construction of the interconnection station will be available to accommodate the City of Bartow in eventual connection. Polk County, in good faith, relied upon the City of Lakeland's commitment to proceed with the project and purchase the real property at 4520 County Road 540A for the interconnection station in the amount of $360,000. In exchange for the deed conveyed to a 50% interest to the real estate to the City of Lakeland, the city will pay Polk County $180,000. When the City of Bartow is ready to participate, the City of Lakeland and Polk County will each sell 1/6 interest of land for $60,000 each, which will result in each party having a 1/3 interest. Staff recommended that the City Commission approve the purchase of 50% interest in 4520 County Road 540A from Polk County for the purchase price of $180,000 and authorize the city official to execute all necessary estimates to finalize the transaction. During the purchase, the budget by the City Utilities Department. City Attorney Palmer Davis presided over the items. Commissioner Walker moved to approve the recommendation. Bill Reed second, and the motion carried unanimously. We adjourned our meeting at 8:25 a.m. I think this is about a 3-acre parcel, if I understand correctly. So this is a great day for the county and our moving forward with tying all of our water systems together in the future.
Correct, and if you wanted to show the map or anything that is attached, we can do that, I think, can't we? Okay, never mind. I apologize. But yes, and it's certainly on our website, showing it on there as well. So is there a motion to approve?
So moved.
So moved by Commissioner Franklin, seconded by Commissioner Walker. Discussion by commissioners. Commissioner McLeod.
Thank you, Mr. Mayor. Just a question about the city of Bartow wants to participate but is not ready yet. Do we have any information on that, or when that may be?
We have.
I believe it's just a budgetary issue to talk.
I was just curious. I didn't remember discussing that or hearing that in the committee report. And
Tom Mariachi, Water Utilities. I spoke with Bartow a couple of times, and they went ahead and indicated to us they were having not ready to proceed yet. They couldn't budget the money, so county and city is ready to proceed. So we will proceed, and we will proceed in a way to where Bartow can come in, be able to connect, pay the money, and everybody will be whole.
Okay.
And that timing, Mr. Mariachi, is what would you expect in that timing for Bartow?
I don't know. Probably once the COVID is over and they're able to budget again. Bartow has the longest line they need to install, and their burden to this will be over $1 million.
Got it. Okay.
Thank you.
so it's more than just their share of the 60,000 or whatever. Yeah.
Right.
Okay, that makes a little more sense when we talk about the budget constraints.
And then
for them.
Commissioner Reed, I think we
Thank
have
you.
a question for you too.
Thank you. I have one more question. You know, I'm glad Commissioner McLeod brought this up. If we spend $300,000 or $400,000, I guess we'll get reimbursed for that portion from Bartow.
Excuse me?
If Polk County and Lincoln, we spend $300,000 or $400,000 to get everything ready and situated, in addition to them buying their 1/3 interest, will we get reimbursed for the money we've spent?
If we spend any additional money above buying the property, yes, we would be reimbursed.
Thank you.
And will that be in thirds?
If we proceed with the engineering, it would be incurred, and the only thing that Bartow would have to provide would be their construction after they paid for their share of the engineering and their share of the property.
Okay. Any other questions by commissioners? Any questions or comments by the audience? Thank you, Mr. Mariachi. All those in favor signify by saying aye. Aye. Opposed, same. Unanimously passes. Thank you for that, Commissioner Reed. That brings us to the consent agenda. Is there a motion to approve?
Motion to approve.
From Commissioner Walker and a second from Commissioner Franklin. Discussion by the commissioners. Any discussion by the audience? All those in favor signify by saying aye. Aye. Opposed, same. Also unanimously passes. There are no requests to appear from the general public or equalization hearing today, so that takes us to 3 public hearings, which there are none, and then 4 Community Redevelopment Agency has no report, so City Manager 5. And that will be an interim city manager or an assistant city manager report from Assistant City Manager Cologne. Thank you.
You get it right.
Okay, so item A, recommendation of the renewal of the city health plan stop-loss reinsurance coverage. Voya is the city's current carrier for stop-loss reinsurance coverage. The current contract is due for renewal on December 31st, 2020. Voya has agreed to renew at the current rate, maintaining our premium cost for 2021. The stop loss provides reimbursement to the city on any single health claim that exceeds $435,000 during a calendar year. Voya's proposal will renew at the current per member per month rate of $32.74 with an enrollment of approximately 2,600 employees and retirees on the plan for an approximate annual premium of $1,021,488. It is recommended the City Commission authorize the appropriate city officials to renew the stop loss coverage with Voya effective January 1st, 2021 as presented.
All right, is there a motion to approve?
Second.
Commissioner Walker, and seconded by Commissioner McLeod. Discussion by commissioners. This is the stop loss we talked a little bit about at the agenda study. Any discussion? Any discussion by the audience? We defer to our insurance expert here, so if his hand just twitches the slightest amount, we're ready to utilize it, his expertise. Any discussion by the audience? Okay, this is a voice vote. All those in favor signify by saying aye.
Aye.
Opposed, same. Unanimously passes. Item B.
Item B is the recommendation regarding the reimbursable agreement with the Federal Aviation Administration for a siting study to relocate the very high frequency omnidirectional range at Lakeland Linder International Airport. The airport has received reimbursable agreement from the FAA to complete a site study to relocate the VOR at the airport in the amount of $56,044.88. The siting study is due to a proposed new runway 10R28L included in the airport's master plan that will require the VOR to be relocated. The reimbursable agreement provides technical consultation, project planning, review of design packages, and construction oversight. The airport is seeking authorization to execute the reimbursable agreement with the FAA in the amount stated and to be funded from the airport's fiscal year 2021 budget. It is recommended that the City Commission authorize the appropriate city officials to enter the reimbursable agreement with the FAA. No appropriations are required to accommodate this request.
So moved.
Second.
And there's a second, so Commissioner Reed made the motion, a second by Commissioner Madden. Discussion by commissioners. Commissioner McLeod.
Thank you, Mr. Mayor. And just for clarification, the very high frequency omnidirectional range is or does what? You seemed very well versed in it on Friday, and Mr. Mayor, I remember I was sitting there thinking, I'm not sure I know exactly what that is.
So first of all, they're a little white tower that goes just like this that you see out in an airport field, and they go dee 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 dee. But now we can have the real answer.
It's actually a GPS appreciation instrument because it's a type of instrument approach that virtually no one ever shoots anymore. But I don't know. Gene, do you guys track? Do you have any records of how many people, other than students who have to do it on an instrument check, actually shoot a VOR?
Well, good afternoon, Gene Conrad, Airport.
He says, I'll clean this up.
Appreciate the questions. Long and short of what the VOR is, we do not track who's shooting what type of approaches or whatnot because it'd be very cumbersome for us to be able to do that. But what the VOR is essentially if you've been out to the airport, it actually looks like a giant bowling pin in the middle of the airfield. And actually, this VOR is the VOR or the antenna really for the center of the state. So as traffic from the south. From South Florida is coming north or vice versa, or as aircraft are transitioning over Tampa coming from the west going into Orlando, they're all going over the top of this antenna at various altitudes, anywhere probably from 5,000 feet, if not up to 35,000 feet. There are flights that I saw the other night actually from France that are going to Mexico. They're going over the top of us, so it's a very important instrument. But in our purposes of moving it are for our future parallel runway, which we've all talked about, which would be 10 right, 28 left. That's,
Sorry about that.
First time. So anyway, that's okay. And in order for us to be able to put in that runway, we have to move that. And if you've seen the agenda item, it is to move it south into what we call the Sun and Funds parking lot. So there's a lot that goes on with this. It'll be several $1 million for us to move it. We'll come back. Obviously, it'll take us a couple of years to get there, but we should receive grants from the state to be able to move it and get it in the right location for our future development.
And it's used for pre-GPS for locating where you are, correct, for planes?
Absolutely, for anybody who's flying over the top. And there are specific approaches into the airport that use the antenna as well.
Great, thank you. That's all.
Thank you. Any other questions? All right, any questions by the audience? All those in favor signify by saying aye. Aye. Opposed, same. Unanimously approved. Item C.
Item C is a recommendation regarding the task authorization with Wood Environment and Infrastructure Solutions for Phase 2 of the Stormwater Management and Resiliency Master Plan. The City of Lakeland Lakes and Stormwater Division has a professional services agreement with Wood Environment and Infrastructure to complete a comprehensive stormwater management and resiliency master plan. The purpose of the plan is to assist the city with identifying and addressing potential flooding problems and to prepare for future stormwater storage, treatment, and conveyance needs, as well as reduce future flood risk hazards to meet the city's growth and redevelopment needs, as well as regulatory requirements. The plan will be utilized to identify strategies to reduce flooding, protect public safety, adequately manage stormwater capacity, reduce stormwater pollution, and maintain and enhance surface water quality, and clearly define existing and proposed drainage conveyance systems that may or may not be on lands under the city's control. This resource will allow the city to determine areas where easements or ownership agreements may be lacking. The updated plan will provide for an all-inclusive set of resources for the city to manage development so that changing conditions can be maintained in perpetuity. Wood has completed Phase 1 of the comprehensive plan, which included a detailed review and revision of existing hydraulic and hydrologic computer models and complete conversion and update to the most recent and usable model. Now, Phase 2 of the plan will expand upon and refine the model constructed during Phase 1, including the review of the Southwest Florida Water Management District environmental resource permits and calculations for all permitted systems containing stormwater ponds of half acres or larger, and incorporating those data into the H&H model. Incorporate City of Lakeland GIS inventory data attributes for stormwater systems, convert rainfall data to the green and AMP methodology, and develop long-term rainfall simulations for evaluation of pollutant loadings to the city's lakes from stormwater runoff to assist with source identification and restoration avenues, and hyperlinking stormwater conveyance maps and supporting documents like easements, right-of-ways, ownerships, and other legal documents. Additionally, Wood will train city staff on the use and interpretation of the updated model data input and results. Funding for this project is provided in the fiscal year 21 Stormwater Utility Fund budget. It is recommended that the City Commission authorize the appropriate city officials to execute a task authorization with Wood Environment and Infrastructure in an amount not to exceed $199,576 to implement Phase 2 of the Lakes and Stormwater Management and Resiliency Master Plan.
Is there a motion to approve?
Motion to approve.
Commissioner McLeod, and second by Commissioner Franklin. Discussion by commissioners. Commissioner Madden.
Thank you, Mayor. I was wondering if we could just have some context with regard to the data collection and how this is iteratively and incrementally improved over the past 10 years, and how are you excited about the advances we're making in data collection? Does it make your life easier? Does it make it a more serious science when trying to detect what we need to do for our lakes? I was thinking about even like with our FEMA folks being able to, with LE, do the GIS tracking of all of our poles and our infrastructure for LE, and that data collection just streamlined, such a great advancement. Is this that awesome, or is it just a small iteration better?
Hi, Lori Smith, Manager, Lakes and Stormwater Division, and I am managing this project on behalf of the city. And you are correct that it is awesome. The last time the city had a comprehensive stormwater management plan was prepared in 1992. Wow. So you can imagine the technology improvements since then. So things like ICPR4, which is what the model has been constructed in, is miles above the model that was done 30 some odd years ago. Where also, GIS has come so far, and the city has gone so far as just our tracking in GIS of our stormwater features is amazing. So to be able to convert that into the model, and then take that model, and every time a new development is proposed or a redevelopment is occurring, we plug all the numbers into the model, and it will tell us this property does not present a flooding hazard or a public safety hazard, or at a 25-year storm event, there may be a flooding risk to the neighborhood, so let's plan for that while we redevelop. So it's an amazing model. This is the next iteration where we take all of the data that's out there and plug it into the model, and then start training our staff on how to use it.
Well, I'm so excited, and I would love to have you give me a little show and tell when it's all.
Absolutely, okay. Yes, all right. That would be great.
Thank you, I'm excited.
Excellent. Great comment and question. Other questions by commissioners? Any by the audience? All those in favor of this significant, awesome event signify by saying aye. Opposed, same. Unanimously passes. D.
Item D is the recommendation regarding regarding Affordable Housing Review Committee impact fee waivers for Parker Point Apartments. On October 8th, 2020, the Affordable Housing Review Committee met and reviewed an application from Tigertown GMGP for the waiver of 100% of non-utility impact fees for Parker Point Apartments, a proposed affordable housing apartment community to be constructed on city-owned property located on East Bella Vista Street. Tigertown GMGP applied for and was awarded the Community Development Block Grant, Disaster Recovery Funds, Multifamily Mortgage Revenue Bonds, and a non-competitive housing credits from the Florida Housing Finance Corporation for the 88-unit development, of which 14 are very low-income units and 74 are low-income units. The total development cost for the project is estimated at $21,277,970. Based on the Affordable Housing Incentive Plan, the committee may recommend approval of impact fee waivers up to 75% for very low-income units and up to 50% for low-income units that fall outside specified target areas. This equates to a total of $227,064.50 of impact fee waivers for Parker Point. Tigertown GMGP is requesting the waiver of the balance of $214,519.50 in impact fees for a total of $441,584. Tigertown GMGP has also submitted a request to Polk County for approximately $545,688 in impact fee waivers. This request is in line with the City Commission's continued focus on affordable housing. One of the long-term strategies being considered to encourage more affordable housing is 100% impact fee waivers for affordable housing outside the designated target areas. It is the recommendation of the committee that the developer receive 100% waiver of non-utility impact fee in the amount of $441,584.
Move approval.
Second.
Motion to approve by Commissioner Walker, seconded by Commissioner Reed. Discussion by commissioners. Commissioner Reed.
Did we find out, Derek, what the probability from the county waiving their $500,000?
We'll find out in just 1 second.
Good afternoon, Teresa Mayo with the Community and Economic Development Department. We don't know what the probability is because the application has not been completed with the county, so I understand that there's some additional forms that they need to submit and have notarized. But based on past experience and other applications that have gone through, the county tends to follow in line with the city in granting the waivers. So I can't tell you exactly whether or not it will get approved, but there's a high likelihood that it will.
It'd be consistent.
Yes.
Yeah.
And Commissioner Reed, I think you also had a question about the Impact Fee Trust Fund from Friday's agenda study.
Right.
So Deidre did pull those numbers, and the current balance in the District 1 fund is $900,000, and that takes into account year-to-date collections and then also capital expenditures that are programmed for fiscal year 21. And then in the out years, which is 2022 through 2030, there is approximately $1.6 million that is budgeted for projects. However, this fund tends to have an annual revenue of $900,000, so it is in a good position to fund those additional projects.
Any other questions, sir? Any other questions by the audience? All those in favor signify by saying aye. Aye. Opposed, same. Also unanimously passes. E.
Item E is a recommendation regarding approval request to execute the Bureau of Justice Assistance Coronavirus Emergency Supplemental Funding Program Award. On March 30th, 2020, the BJA, or the Bureau of Justice Assistance, began accepting applications for the Coronavirus Emergency Supplemental Funding Program. The program will provide $850 million in nationwide funding, of which $18.5 million was awarded in direct allocations to several jurisdictions in the state of Florida, to include the city of Lakeland. The program will provide funding to assist eligible states, local units of government, and tribes in preventing, preparing for, and responding to the coronavirus. The awards are considered grants. The City of Lakeland and the Lakeland Police Department were notified that our award is for $80,481. LPD intends to use the funds to replenish personal protective equipment, or PPE, supplies used as a result of their response to the COVID-19 pandemic. Additionally, new but relevant equipment is also being considered to assist with law enforcement's responsibilities to the public during crises like the COVID-19 pandemic and incidents that would be considered statewide emergencies. It is requested that the City Commission authorize the appropriate city officials to execute the award offer from the Bureau of Justice Assistance and authorize an increase in estimated revenues of $80,481 and a corresponding appropriation in that amount in the general fund.
So move.
Second?
So Commissioner Reed and Commissioner McLeod seconded. And the discussion on this from commissioners would include any questions? Any from the audience? All those in favor signify by saying aye. Aye. And opposed, same sign. Unanimously passes. Thank you very much, Assistant City Manager Cologne. And that brings us to the City Attorney Davis, who is sitting down here.
Mr. Mayor, we have one ordinance for first reading. This will be by state law, read by title only at today's meeting, and we'll come back to you for a full public hearing on November 2nd. That ordinance is proposed ordinance number 20-040, an ordinance of the City of Lakeland, Florida relating to pole attachments, making findings, amending ordinance 4899 as amended to establish rates for wireless communication facilities on city poles, providing for severability, providing an effective date. Once again, that'll come back for a public hearing on November 2nd.
Thank you.
One resolution for action today, that is proposed resolution number 20-047, a resolution expressing the intent of the City of Lakeland, Florida to incur costs related to the acquisition and construction of a new power plant to replace McIntosh Unit 3, expressing the intent for purposes of compliance with the United States Treasury Regulations Section 1.150-2 to reimburse with the proceeds of revenue bonds the capital expenditures made with respect to such project, providing for the intent for the future issuance by the city of notes, bonds, or other obligations in one or more series in an aggregate principal amount not exceeding $150 million, which shall be applied to pay the cost of such project, providing an effective date.
Motion approved by Commissioner Walker and a second by Commissioner Franklin. This is our next big step moving forward with respect to our elimination of Unit 3, and so this is the first piece in that whole process that allows for the funding. Commissioner McLeod, do you have a question?
Thank you, Mr. Mayor. I was just going to have Palmer restate. You mentioned on Friday that this resolution is necessary to comply with IRS regulations.
Right.
I think that's helpful to just for our context and for others to understand.
Right. More than likely, this will initially be financed by something other than bonds and then refinanced by issuing some revenue bonds. And just according to IRS regulations, when we do that type of thing, we have to adopt a resolution stating that that is our intention. So that's what we're doing.
Thank you.
So this is interim funding for same. Any comments from the audience on respect to this or questions? Seeing none, all those this is a roll call vote. Commissioner Walker.
Aye.
Aye. Yes.
Aye.
Aye. Unanimously passes. Thank you. That brings us to item C1.
Several miscellaneous items for action today. The first is a proposed memorandum of understanding with Michael J. McGee and Kathleen McGee for a donation of $600,000 to the city to assist in the construction of Phase 2 of the Cypress Youth Sports Complex. That's an approximately 33-acre park located off of South Edgewood Drive in southeast East Lakeland. That park currently has 4 multi-purpose fields, a restroom facility, parking, and a maintenance building. Phase 2 of the project will add 2 additional multi-purpose fields, a playground, walking path, and additional parking. The city has approximately $1 million in impact fees in its public improvement fund earmarked for this project. So with the McGee's donation, that will bring the amount of funds available to construct Phase 2 to $1.6 million. In recognition of that donation, it is recommended that that park be renamed in honor of Mr. McGee's late father, John McGee. So it would be the John McGee Park. And I understand that the McGees are here this morning if they have anything to say or if you have any questions for them.
Well, first of all, we want to thank you for your patience in waiting for this item to hit the agenda at this point, and also are so grateful for your generosity. Would you like to make any comments with respect to what you want to accomplish? Yes. Yes, that'd be great.
to thank the mayor and the city commissioner for a favorable response upon the changing of the name of the park. I also want to say that it's been a delight working with City Park Manager Bob Donahue and his assistant Pam Page. They have helped immensely. And with me today is my wife Kathy and my son Kevin McGee. But just a few words about my dad, and the reason for doing all this is that my dad was born and raised in Omaha, Nebraska, graduated from Creighton University, and shortly afterwards married my mom and went to work for the Goodyear Tire and Rubber Company, which has been in the news lately, where he stayed for 17 years, and during all this he had 6 children, me being the oldest. During this time he moved practically every other year, and while he was working up the corporate ladder he had to accept a promotion, and so he lived in 4 different states: Nebraska, Wisconsin, Iowa, and Minnesota. So after the last move, my parents decided, well, it's enough moving. It's enough moving up the corporate ladder. It's time to stay put. So they were thinking,
and too cold.
Yeah, well, that comes later. So back in 1974, while on a business trip to Florida, my dad met another businessman here from Lakeland called Joe P. Ruthven. And Joe happened to have 2 tire stores for sale. And of course, back then there was no cell phones, no internet, and my dad could hardly wait to go back to Minnesota to see my mom and give her the good news about this potential deal. So as he flew back to Minneapolis, he drove back down to Winona, Minnesota, which is about an hour south of Minneapolis, and walks in the door, and there and behold was Joe Ruthven talking to my mom.
You're kidding.
About the merits of moving to Lakeland. Promised 3 things. He promised no snow or ice. Practically every house has a swimming pool, and you're only 45 minutes away from Disney World. So with that, it was sold. They were ready. So at that time, I was living in Dallas, Texas, and my wife and I were recently married, and called me up and said, hey, would you join me and to go to Lakeland, Florida, and help me with these 2 tire stores? Well, I could hardly wait. My wife and I got packed, and we loaded our 4-foot U-Haul trailer and drove our 1971 Ford Maverick to Lakeland. At that time, I-10 was only partially completed, so a lot of the way here was going on 2-lane highways going to the east. And so my dad put his house for sale, and with that, and Joe financing the balance, he was able to make this purchase. Now, back in 1974 was a particularly hard economic time. Back then, and I just verified this, that the inflation rate, the interest rate, and the unemployment rate, all 3 were over 10%, causing stagflation. So this is probably not the best time to buy a business and move clear across the country with your family. However, my dad, I don't think he even thought about that because he was going. And so for the next 16 years before my dad retired, he exhibited 3 characteristics, which I want to go over real quickly. First of all, he was a man of faith and family. He believed in God and loved his wife and family. I remember growing up in the Midwest on a Sunday when it was 20 below zero and 8 feet of snow and wind blowing. We went to Mass every Sunday. Weather was not an excuse. He kept his faith right to the end of his life when we would visit him and you see his rosary beads on the side of his chair. Secondly, he was an entrepreneur with a vision. He sold their house in Minnesota and put everything on the line for this to be a success. At that time, there was not a bank that would give him a loan, so fortunately, like I said, Joe had financed it. Within about 5 years, 4 of his children were in the business. The next trait, he had humility. If there was an exceptional month or year, he would congratulate everybody in the company. He never patted himself on the back. If we had a bad month or year, he would take the blame for it. So he gave me several words of advice. Always take care of your customer employees and surround yourself with the best people and always look for opportunities. Kind of like what Dr. Thompson's been doing. He retired in '91, and as we were acquiring our 4th store on 320 West Main, which is where the Opportunity Center is now, he transferred the company to myself and 2 siblings, but kept on kind of working and helping us with some valuable assistance. In 2014, myself and siblings sold the company to my son and 2 key employees. And fortunately for them, they got an offer they couldn't refuse from a publicly traded company and sold the company again. At that time, we had 30 locations and 200 employees throughout Central Florida. Going back to the park, this unique playground will have an automotive theme. So in the playground, there'll be hopefully like a car on a lift and a truck on a lift with a ladder and steps going up. So toddlers can go up there and honk the horn, turn the steering wheel, and then slide back down on the slide. And other items that are on the agenda for the park are park benches and a picnic pavilion. Anyone wishing to make a donation to buy those, they can contact Lori Martini at GiveWell, where there's been an account set up, and then they will the funds will go to the city then. But thanks again for your approval on this, and we look forward for the park getting done.
Thank you so much for your generosity. Okay, to formally make that approval, who would like to make a motion? Motion from Commissioner Reed, and then seconded by Commissioner Walker. And the discussion by commissioners? And any by the audience, other than here, and amen? All those in favor signify by saying aye. Aye. Opposed, same. Unanimously passes, and once again, thank you for that express generosity. Yes.
For social media purposes, could we get a picture of the family and you, so for social media, please?
Excellent. Yes, sir.
Thank you.
Are we masking McGee's? No.
It's up to you.
If we stay 6 feet apart, we don't have to mask, and if we want to hug.
Okay, do
Well, I'll put my wife next to you then.
Thank you so much.
The next item for action today is a proposed agreement with Sin State Contractors of Winter Haven for the rehabilitation of the headwork structure at the north side wastewater treatment plant. This project will include the removal of a portion of the top concrete slab, water and sand blasting of the walls, remove loose concrete and coatings, the application of grout and new coatings, installation of aluminum covers in place of the concrete top slab, the extension of odor control ducting, new screening equipment, and a new grit classifier. Sin State Contractors was the lowest responsible bidder in the amount of $1,406,862, and it is recommended for your approval.
Motion to approve by Commissioner Walker and a second by Commissioner Madden. All right, a discussion by commissioners. Commissioner Madden.
Thank you, Mayor. I was wondering, City Attorney Davis, if you could comment. Certainly, it looks like this is, above the percent that we approved in our local vendor preference. But since we're going to be talking about that on another thing, I just want us to always kind of be cognizant of that. Like, what's the threshold for that local vendor preference? I see there's a Lakeland company here, Vogel Brothers, and certainly it's, it looks like almost $200,000 more. But, I just want to always bring that up because we did go through an extensive process of seeing, what we wanted to do as a commission with regard to making sure our local vendors are given a fair shake. So is it a 5% threshold?
5%, correct.
Okay. So I was sure it was over that threshold. I just wanted to take a moment, in the public comment to say that we always are keeping that in mind.
Right, and we're going to be bringing something to you actually in the near future to solidify that. So you'll be looking for an ordinance to actually solidify our local preference to make sure we're on a good foundation with that.
Great, thank you.
Excellent.
Thank you.
Any other comments by commissioners? Any by the audience? All those in favor signify by saying aye. Aye. Opposed, same. Unanimously passes.
And I think the last non-consent item under miscellaneous was a commitment letter, proposed commitment letter to Blue Griffin Terrace LLC for their Swan Landing development, which is phase 2 of a proposed affordable housing, multifamily housing community on Griffin Road, just off of the intersection of Griffin Road with Highland Fairways Boulevard. In September, the city released a request for applications to offer to match funding at the state level, tax credit financing funding at the state level for developers, affordable housing developers interested in developing multi-family affordable housing. And we had 3 respondents to that RFA. One was Green Mills Group, the second was Blue Griffin Terrace LLC, and the third was Twin Lakes, the third LTD, 3 LTD. Those submittals were reviewed by the Affordable Housing Review Committee, and that committee ultimately determined that they would recommend the award of this to Blue Griffin Terrace LLC. One of the main factors for that was that they had offered more 2- and 3-family bedrooms with their multifamily housing. This would be a 50-year deferred loan to Blue Griffin Terrace, and it would be contingent upon them receiving the state tax credit financing. That's recommended for your approval. We have Andy Gibson here from Housing if you have any questions.
Is there a motion to approve?
Motion to approve.
By Commissioner Walker and a second by Commissioner McLeod. Questions by commissioners? This we also received a supplement email on as well. Commissioner Reed?
I may not have seen that, but I had asked them to bring up a slide so we could see where the different projects were located.
So I think we get Annie at the podium and Teresa at the slide.
Annie Gibson, Housing Program Supervisor. I believe we have some maps. So Blue Sky is a little further up on Griffin. Then you have the Green Mill, which is right off of Griffin and 98. And then, of course, Lakeland Housing Authority is further down on Henderson.
May I ask some questions, Mayor?
Yes, please
Thank
go
you.
ahead.
Is Blue Sky, are there different phases to each one? Is some of them are brand new, or is there a different phase 1, phase 2, et cetera?
Well, Blue Sky, this is the second phase. So probably about 2 to 3 weeks ago, we approved some assistance of $400,000 of affordable housing funds for phase 1. This is phase 2.
So they haven't started phase 1 yet?
They are clearing ground, I believe.
Yeah, they're clearing ground.
Okay, and then the let me look at them here. I can't remember which ones. What about the Twin Lakes?
Twin Lakes is the third phase of Lakeland Housing Authority. So they tore down some of those units. So this is the third phase. They have to tear down more and rebuild.
We wouldn't get any real estate tax from that, would we? Ad valorem tax?
I'm sorry?
There's no tax benefit for us from that per se for ad valorem tax?
For Twin Lakes?
Yes.
I don't think so, because
I would
it's
not think
located
so.
in
That's a non, yeah.
That's
Like a housing
that's
authority.
not, that's not, yeah.
Lakeland Housing Authority. I don't
Okay.
believe so.
That's LHA.
And then the other one is a phase also?
Not the
Green-
second,
Green-
no, sir.
Green
This is
Mill?
development.
It's a new start. I mean, a new unit.
So only Blue Sky and Twin Lakes. So Blue Sky is the second phase and Twin Lakes is the third phase.
Okay. And then Griffin would be a brand new,
This is a brand new development, yes, sir.
Commissioner Madden.
Thank you, Mayor. Thank you, Annie. So this is certainly getting exciting. I feel like we're placing our bets on a race here because we are on our goal to 500 units, and we have these great developers who are, building units for us now. I remember when Blue Sky didn't have a development in Lakeland, and Green Mills, won that round because they had Ada Palms that we could visit and see firsthand what a quality development project that was. So it is difficult for me to not just want all three, to win this race. And I'm just like, how can we make more than, how can they all win? Because we really need them all. I certainly understand that from our area, only one project would be able to win, based on the state and the federal funds.
Well, on this particular RFA from the state, you would have one winner, but if you're looking at the chart below, we do have an additional pot of money that hopefully in the near future will be completing another RFA for those funds.
Okay, and then is there feedback? I see that, we had a great discussion on Friday talking about 2 to 3 bedrooms being appropriate for families because we've already had some units for veterans or for seniors, and so we're trying to make sure that we keep that family, particularly with homeless students, at front of mind. Also the proximity to our core and transit services and our hospital. Also, being in the CRA versus not in the CRA makes a difference. And then also not just the number of units. I know that Blue Sky had more units, but then really, important to look at the percentage of AMI mix of what they're offering. So we don't just sign off on something that's more units, but maybe not in that, lower affordable category. So I feel like on Friday we had a lot of good discussion as to why, how this group won the bid. But I just wanted to publicly say that we're just thrilled that developers are getting these projects in Lakeland and are going with city monies and with high quality projects and seem to be getting them each year, to get these state and federal dollars. And I hope that, the Twin Lakes Phase 3 and also the Green Mills project could still go forward, maybe with some other dollars, like you said, with some other funding that we have. Does the staff provide information to the projects? To me, it seems like as an outsider, looking in, that they were really close, neck and neck as far as what they were offering. Do you give feedback as to, we really would like to have more in this area because, transit or parks or other services, it would be wonderful for affordable housing. Or I know with CRA, at our board retreat, we talked about, more creative ways in how do we use the CRA land to maybe partner with developers, with these type of projects. So that they will be in the CRA area and then the taxes go back into that redevelopment. So anyway, I just wanted to take a moment. We had the discussion on Friday to just kind of make sure everyone knows how important affordable housing is. It's front of mind. We have quality developers here. We wish all three could win. But as they leave and the ones who didn't win this round, do they feel encouraged, to apply again, that, maybe there's even another way to get the funding besides this route?
Well, we have these city funds, but we also have the Florida Housing Finance Corporation. They have 2 rounds of fundings in different pots of funds. So probably in the springtime, there's another pot of bond money or Florida Housing Finance money that will be available to those developers.
And to her question, they don't get discouraged. They know that.
Oh, no.
They
They just
that.
keep on going. They just keep
Okay.
on
They
going.
know the process, yeah.
Oh, yeah. They just keep on going.
Okay.
Other comments by commissioners? Any comments by the audience? Annie, thank you so much. All those in favor signify by saying aye. Aye. Opposed, same. Unanimously passes excitingly. Thank you. We look forward to working with Blue Sky on this. All right. That brings us to the end of your section, sir. There's not a report from the finance director, and that brings us to miscellaneous, item 8 for utility C1.
Good afternoon.
Good afternoon.
Mona Siriani for the City Attorney's Office. The first item that we have is an agreement with SPE Utility Contractors, FD LLC, This is for relocation of approximately 915 feet of Lakeland Electric's 230 kV transmission line, which is located west of Kathleen Road. There's a requirement for us to relocate that because it's currently in FDOT right away, and the construction project that's going on with FDOT while the CSX Railroad Bridge over I-4 is being rebuilt. So we are being asked to relocate that about 300 feet north of its current location. In September, the city's purchasing department solicited bids. We received 3. SPE Utility Contractors was the lowest bid in the amount of $229,998.76. It's important to note that the city will not incur any of these costs. Will actually be reimbursed for the total amount, so it will not be expenditure for the city. And I would point out, as discussion was had on Friday, there is a significant difference between the low bid and the other 2 bidders, and that stems from these types of contractors ever since Hurricane Irma. They have been involved in numerous projects throughout the state and have substantial work, and this is a particularly small project. So those other two contractors quoted quite a bit higher. I didn't want to say they didn't want the work, but they certainly are busy with other larger projects, which is part of the reasoning for SPE being awarded the low bid on this one, and we would ask for your favorable approval.
So moved.
Second.
Okay, motion and second by Commissioner Madden. Discussion by commissioners. Any discussion by the audience? All those in favor signify by saying aye.
Aye.
Opposed, same. Also unanimously passes. Item 2.
The second item is an agreement with Sulzer Pump Service. This is for inspection and repair of Unit 5's main boiler feed pump, which supplies the pressurized water to the HRSG to make steam for the unit. This has not had a major overhaul since Unit 5 was constructed approximately 20 years ago. In September, the city's purchasing department solicited bids. We received responses from 9 vendors. The lowest actual bidder was Mid-State Industrial Maintenance. However, they were not awarded the agreement in this case because they were unable to meet the city's specifications. So Sulzer was selected. Sulzer Pump Services, Inc. was selected as the lowest, most responsible bidder at $63,247. I know on Friday there was a significant discussion regarding the Mid-State and the selection criteria that was used, and we do have staff here to answer any specific questions that the commission may have regarding the award of this particular contract and why it did not get awarded to Mid-State, if the commission wants to entertain any questions from staff.
So first of all, is there a motion to approve?
So moved. Second.
So moved in a second from Commissioner McLeod, right?
Yes.
Yes, okay. Discussion by Commissioner Madden.
Thank you, Mayor. Thank you, Ramona. So I just wanted to, bring it up because I did receive, having Mid-State be a local company,
Sure. Mm-hmm.
They did reach out to me. I think it was probably about 2 years ago now, when they didn't receive a bid and they were the lowest bid. And so at that time, I went and toured their facility, and we were, kind of having those discussions about local vendor preference. We didn't really have the specifics to what our local vendor preference would be yet because we hadn't gone through the whole process. But I did, advocate on behalf of them as the lowest bidder and as a local company who has, 500 plus employees who live, work, and play in Lakeland area. And so I just think it's really important. At that time, I toured the facility and I reached out to Lakeland Electric to say, I know sometimes, it's hard to try a newer company on something you might not think that they have capacity for, but since this is just down the street, if we could have our LA folks go tour and actually see ahead of time, what their capabilities were when they're not in a bid process, then maybe when they go through the next bid process, they will have a more, comfort level. So I was notified again by Mid-State this time that they were the lowest bidder and that they didn't receive the work. They do other work with Lakeland Electric, but at that time they had been interested in going through the process of rebuttal, of the bid. And so I had City Attorney Davis get the information to pass to the CEO of Midstate, Jeff Klein, so that he would know how to go through the process if he wanted to, what's the term?
Bid protest.
Or just to protest the bid. He, I think, had some conversations with Mr. Ivy, and in the conversations with the purchasing department, I think he felt at least listened to and heard, and he did not decide to go through the protest process. But because of that situation, I just, on Friday said that I would not personally want to vote in favor of this, because I feel like if we would have had Lakeland Electric go to Midstate and to really take a tour and to talk to them, then maybe they would have, had more confidence in this bid process. So great. So Mr. Ivy's here to talk about that.
Thank you for your comments. We certainly do want to do business with the local suppliers as much as we possibly can. This was a situation that got away from us, I'll be quite honest. These people actually could do the work, but we were told that they could not by their own people. And so that's why they weren't awarded this bid. That's the only reason, really, that they were not awarded this bid. Since then, our plant manager, Mr. Steve Reinhardt, has toured their facility, and what we found out was the person they talked to said, no, he could not do that work, but he didn't say, I've got like 10 technicians that can, right? And so it was a total miscommunication. It got away from us. I think we've cracked that nut. I think we've solved that problem going forward. And to your point, they're right down the street. So we've already closed out this process. We do need to move on with it. However, we do know now there's going to be plenty of other opportunities down the road to keep this going. We are doing business with them. It's not like we're not doing anything, but this is a bigger deal that would have meant more for them, and we get that. So we're going to try to fix that going forward and make sure that we know that their capabilities are such that they can handle this going forward.
And I just want to thank you for your leadership on that, because that wouldn't have happened if you hadn't listened to his complaint and gone, and made sure that they took the tour. So
You had a big role in this too, so thank you.
Thank you very much for checking into that.
Why, I have one question, sir.
Okay.
Why is it already too late?
We've gone through the whole process. I'm not going to speak for the city attorney, but we've gone through the whole process. The opportunity to protest has passed, and I'll be quite honest. I told him he can protest if he wants to, but based on what I had heard, it's pointless, because what we'd heard is that they told us that they could not do the work, and that's why that decision was made. So we fully satisfied that process, and we're now in the situation where we just need to move on and get that boiler pump rebuilt.
Just to elaborate on that, I mean, essentially, this is information that was developed after the bids were opened, so that violates, the principle of sealed bidding.
So the sealed bidding is the primary reason. Okay.
Yeah, I was trying to understand the same
Okay,
situation.
that just flinched us all a little
Makes that
bit.
a lot better.
Yes, sir. All right.
So effectively, we just rubber stamp it anyway then.
That's
So,
effectively.
we're basically saying we couldn't change the decision if this body wanted to anyway.
Well, if there was information that had been provided prior to the bids being opened, then, I mean, the commission clearly could assess that differently than staff, but this is information that was developed after the bids were open, so I think there is a little bit of difference there.
Yeah.
We certainly want to solve this on a going forward basis, because we want to be good community partners just like they do.
I know.
Yeah.
Well, that's what I feel better about, because I feel like, that's kind of why I wanted to bring it up, because 2 years ago, if we would have done this, then then they would have known their kind of been pre-qualified. And so at least hopefully they won't miss out on the next opportunity, because we have made that connection and taken the tour and,
But I want to make sure I understand, if I could, Mr. Mayor. Are you finished, Mr. Mayor? Are you finished?
I think so, yeah.
I just want to make sure I heard it right, because I heard right too, and I agree with what you said and indicated. But did they also say some things that kind of caused some situations? I thought I heard.
It certainly was a miscommunication.
Okay.
But we've solved that since then.
Okay. All right.
Commissioner McLeod?
Just continuing in this line of thinking, so they submitted a bid, but then said they couldn't do the work. I'm struggling with that.
They submitted a bid and they were the lowest bidder. Everything looked fine as far as that went. We had some people on staff reach out to them to make sure, because this is a bigger pump than normal, right? It's not just your average run-of-the-mill type situation. When they reached out to them and asked them, here's what I've got, here's what we're really talking about, can you guys work on this? And he was told no. I'm paraphrasing.
Sure.
Right? But he was told no, and so we were satisfied that we had to move on to the next bidder.
And how, when you, Joel, said that we fixed that miscommunication, what does that look like going forward?
Steve Reinhardt, the plant manager, has toured their facility, talked to their technicians. They've gone past the person that said no, and they realized that he meant he couldn't do it personally. I don't know why he would have said that, but that's what he said. And they've got a whole shop full of people that could have taken care of this. And we were satisfied with that. So it was very unfortunate miscommunication.
It's a very unfortunate.
Yeah, it's very, very, very unfortunate.
And all that, by the way, was learned after the bid protest period had closed.
And one other thing, just from a legal standpoint to take into consideration is that there's a record that has been created now to support Sulzer Pump Services getting the work. So there's the potential for a protest arising out of any action you take today. I know I think this is work scheduled for the upcoming November Unit 5 outage.
Unit 5 is in an outage right now, and this pump is technically sitting spare, but we still need to get this done because it's the only spare. So we had to move the spare in to take this one's spot.
So it would be prudent for us to proceed, even though we are not so excited about this.
That's our request.
But we will be really upset if it happens the third time.
I think you would probably come looking for it.
I will definitely come looking for you.
All right. Any comments? Is there any additional comments you'd like to make? Anyone else in the audience? Because I thought maybe there might be. Okay. All right. Any other comments from the audience? All right. All those in favor signify by saying aye.
Aye.
Opposed, same.
Nay.
And that is Commissioner Madden on the nay. All right. That brings us to audience participation. Are there any members of the audience who would like to share something? All right. I see none. That would give us an opportunity for the members of the City Commission to share. Why don't we start any topic you'd like with Commissioner Walker, and we'll go this way. How's that?
Well, thank you, Mr. Mayor. I guess some, bittersweet news I want to share. I don't know if many of you may be aware, and you have already been shared. But we had a former educator and Polk County School Board member, former educator and former Polk County School Board member to pass away over the weekend. Miss, excuse me, Smith, Deborah Smith Wright. Deborah Wright. And I just want to make sure our Lincoln community know that Deborah's passing was over the weekend, and services have been planned already for her. I think the wake is it's coming Wednesday, 3 o'clock to 6 o'clock at the Williams Funeral Home Chapel in Bartow. And then her service will be Thursday at 3 o'clock here in Lakeland, graveside service at Oak Hill Cemetery, our, of course, Lakeland Cemetery here on the Highway 98 South. Many of you probably know Deborah and have had some conversations with Deborah over the years. And also, of course, in our community here, Lakeland, Polk County. That's, I'll call the bitter news, but sweet, I would tell you that we had a very interesting meeting on this past Thursday, I think it was. Yeah, because the general assembly meeting on Friday. So Thursday met with, we call our lead people for our Lakeland History and Culture Center, meeting with Bob Donahue, our Parks and Rec director, along with Ms. Lisa Lilliquist and Luann Mims there at the library. As we're moving forward, we got some final things in order. We saw the floor plan and things have already been approved to move forward with our facilities department with Richard Baker. And hopefully, if we understand it, when we go out to bid, it's going to be 380 days. It'll be the time period that we see the city library, main library, retrofitted to house the Lakeland History and Culture Center. We'll be introducing a marketing plan sometime by the end of this year, because as you all know, the monies that was appropriated to take care of the construction of, there were no dollars to take care of the interior design. So we noticed we'll probably take out another $150,000 to support the interior design and layout of what that particular center will look like inside. And there will be a fundraising effort done by the committee itself. And we're already on the way. There have been some dollars already allocated. Everything's been will be done through GiveWell. Many of you have been approached about donation as well. And again, that marketing piece again should hit the street here no later, hopefully end of the year. Hopefully no later in the first of the year. And others, of course, in the Lakeland community will know about what the ask is in support of completing the actual center itself in its entirety. I want to make sure you all know that. And just like, you know, we heard history from the McGee's about that situation, how that family came to Lakeland and made things happen for what we know Lakeland to be now, we will have something encased in our main library to share with all of us. Our other minority cultures have done things too along the way to share how Lakeland and what Lakeland has become because of their contributions as well. So that'll be some good news to know, and hopefully we'll get the donations we need to help the interior design and layout of that history and culture center completed, and we're looking at probably January 22. We've already planning on welcome kind of an event even as we speak. So thank you very much to my colleagues and Mr. Mayor, as well as allowing us to move forward.
Thank you. Commissioner Franklin.
I don't really have anything. I'm just that last thing just still doesn't sit well with me. I apologize for missing Friday, but it just seems to me that if a committee's recommendation establishes the way we have to vote, then I don't know why we vote at all. And why don't we allow the decision to be made with the committee? Because it seems to me that up until the moment that this body votes yes or no, that decision can be changed. And, you know, that recommendation from the committee was made off of incomplete information that was corrected subsequently. And I don't know why, up until the moment we make a vote, that information can't be made part of the process. I think it's wrong. Unless I may be missing something, but I just don't get that.
Well, I don't think you are missing something. What we were doing in that was probably preventing another protest from the people who would have won it based on that piece of information that they'd said no. I mean, I think.
But yeah, we said there's this other group that was the low bidder has, by their own admission, 10 people who could do the job. I mean, we're even saying that.
Right.
And yet they're being disqualified.
Post-sealed bid opening. That was, I think.
Well,
That's
no,
the
the bids.
distinction that I think is important. Is information developed after the bids are open versus you're assessing information that was available before the pre-bid.
The bids were open, and this one group, CenterState, had the low bid, and it was on subsequent interrogation about, are you really up to the task of this? Then after that, someone said, I mean, it was my understanding, it was kind of verification after the bids were open, and CenterState was deemed to be Midstate was deemed to be the low bidder. So it really had nothing to do with whether it was before. I mean, it was this deficiency, perceived deficiency, didn't even come about until after the bids were open anyway.
Yeah, I just think that's a dangerous road to go down, to assess post-bid information, and I think there were more issues than that as well. I think there's some other problems with what they submitted, that references and things like that.
Yes, our Commissioner Franklin, you know, in part of the selection process, when they received the bids, I believe my understanding, and there's email documentation in public record as well, that they did not submit all the required documents. And then I think what Mr. Ivy was conveying as well, the conveyance that was what was presented was they weren't able to do work on that type of pump. And so based on all those considerations, and the selection committee decided that they did not meet the specifications, and therefore were not awarded the bid. So the notice of intent to award the bid went out, and then the issue was that Midstate did not then follow up with a formal bid protest. And if you do not file a formal bid protest, you waive your right to protest, and all this information was coming after the bid was already opened, and the fact that Midstate had waived any right to a formal bid protest. And if we were to go forward and then accept additional information to supplement that bid at this point, I think we would be opening ourselves up to litigation from Sulzer, because they would argue that they weren't on an equal playing field because they submitted everything they needed to with their bid. So I think that's the important distinction that Palmer's making with regard to that. So there is a little bit more information there, and based on the evaluation of what the selection committee looked at.
So, and that does change things. If there were other pieces of information or stuff that was missing, then that
Right,
certainly changes
correct.
it. But I guess then just going forward, it won't be me, but I guess so when we issue a notice of intent to accept the bid, we've kind of tied our hands at that point. So again, I go back to why does that happen? Why do we vote after?
No, we issue, the purchasing department will issue the notice of intent to award the bid, and then they have, the other bidders have a certain amount of time. That, generally, when that comes before you to finally approve an agreement, that period has run its course.
But if we had had them object, we wouldn't have.
Correct,
done
we
that.
wouldn't be voting on the agreement today.
And they did request information to protest from me, which I provided from our city attorney. And then he had conversation with Joel Ivy, who convinced him he wouldn't win the protest. And so he did not go through the protest thinking, well, I'm not going to win if I go through all the trouble of going through the protest. At my urging, I said, I want a tour visit, and I want to see that they have the capacity, because I don't want this to happen a third time. You know, who's going to make a tour visit? They went to the tour visit, found out that they could in fact do the work. So it could be that they didn't submit all the documentation. You know, they think we're right down the road. We do work for you in the past. You should know our qualifications. And they would have if they would have gone 2 years ago to have this same conversation, but at least they've had the conversation now. So I'm hopeful, you know, that they can be, you know, good working partners going forward in the future.
I'm glad you were bothered, and I think it's worthy of the discussion.
We do really want to try to find ways to have our local businesses
Right.
get established, especially, you know, if it's an area they haven't worked in, they do. And Commissioner Madden, you've raised this a number of times before, you know, you got to get started somewhere, and, you know.
But I'm glad that we're having that kind of conversation. And as I've shared with you all before, having history, because it appears sometimes it's okay for some, that okay, it ain't for none. And for others, and I don't like that.
Right? None of us do.
So we need to continue to stay on top of it if we're going to do the right
Yes.
thing for all,
Right.
you know? Okay.
Well, and the governance side of us, we have to appropriate the money.
Yeah.
You know, so that piece we have to vote for. I mean, there is a process issue in it. And I'm learning this with you, so I'm not doing this as an espoused expert. But if there had been any protest in this, we wouldn't have approved it.
No, you couldn't.
Commissioner McLeod.
Just similar things to what has already been said, and I agree with Commissioner Franklin and Commissioner Madden, and I think the process, the way this unfolded, is a little frustrating, especially when we want to have a strong local vendor preference, and there's a part of me that wishes we could just pick and say, no, but we want this one. They're qualified, they're from Lakeland, but because it's the public bidding process, and it's here that we very likely would run afoul with that and open ourselves up to a challenge. So I felt like we were put in a position where we have to approve it because that information about Midstate came after the fact. However, it happened. So I think it's a good point. It's a great discussion, but it's just that's where we are as it was brought to us. But I'm definitely I share the concerns that you all mentioned.
Well, I think, you know, to Commissioner Walker's point, we're the elected body, so that's where our constituents and citizens, you know, can let us know that they don't feel like they're treated fairly, or maybe there's people in purchasing who feel really comfortable with a particular vendor and not so comfortable with someone else, and so that's why we're here to say, listen, you know, we are watching this process, because it is easy to just vote on things. But, you know, obviously this company reached out to me, so then that brought it to my attention. So I think it's incumbent upon all of us, though, to make sure we're looking at those, so that, you know, just to provide the accountability, you know, to our purchasing department to say this really is of high value to us.
Very good. Mr. Ivey, anything to add?
This particular vendor or supplier was in fact the lowest bidder, and we made the extra effort to reach out to them and try to make sure that they were qualified to do that work. Had it not been for that one little slip up, that one little piece of miscommunication, they would have got this job. So I don't want anybody to leave here thinking that this is routine for us not to want to go local, because that is in fact not the case. We've had run-ins with them before. We've tried to catch this recently to make sure that this is not something that's going to continue to happen. And just like some of you said just now, they're down the street. We can just drive it over to them. They can work on it. We can drive it back. It's that easy, rather than having to ship it someplace. So it should be cheaper, and it should be more effective. And we want to be that partner in this community that gives that work out that way. So hold us accountable. We welcome it. That's what you guys are here for. But I do want you to know and believe that we are trying to make that work on a day-to-day basis.
Very good. Good. All right, anything else you'd have to report, or, okay. Okay, I'll weigh in that we have the Lift Lakeland project in process. That is the process to help us identify some of the gaps that we can help to orchestrate fixes for from people throughout the community, not just from a government standpoint. That's being vetted by stakeholders as of all through last week, and those responses are coming back in so that we actually get a rating from the stakeholders in our community. And then we will discuss that as a commission once we get the compilation of those rankings so that we can see where people are, and we're going to have that at a workshop that we do on the 21st at 1 o'clock as a city commission. Then that rolls out with the input that the commissioners will add into a RP Funding Center meeting that'll be a community meeting on the 29th at 6:30 p.m. I think that's right, 6:30. And so that we have a final opportunity for any other input, missed items or items that could be changed in some way, or somebody else saying, here's another entity that could help to support that. And this provides for both rankings as well as volunteerism, because in order to create the opportunity to fill gaps and to utilize the methods and the talent in our community, the way we accomplish that is that we do so using people throughout the community who help to strengthen the harmony that we have in the community through serving one another. And so that's the purpose of it. It is going to be a more people-intensive response, and it takes us from lip service on these things to raising your hand and saying, yeah, I'll help, I'll take this piece. And that is the process and purpose of Lift Lakeland. Commissioner Madden?
Excuse me, Mr. Mayor. You said
Yes.
The meeting is 6, not 6:30.
6 o'clock, I'm sorry. 6 o'clock on the 29th. That's the all-community meeting, yes, at RP Funding Center. Thank you.
Thank you, Mayor. Could you confirm, did you say it was the 21st is the workshop?
It's the 22nd.
22nd, okay, all right.
It
At
says
what
that.
o'clock?
I was looking at my,
It's
it's the 22nd?
22nd is on your calendar, it's
It's on the
22nd. I
calendar,
just was
Okay, it's just on this.
because it's a typo in this, but on the calendars it's
Got it. Sorry.
Okay,
Thank you,
all right,
22nd.
It's Thursday, yeah.
Well, that's all I needed to confirm.
All right. Commissioner Reed, nothing. And Commissioner McLeod.
I don't have anything that can't wait, Mr. Mayor. I know we've got a 6 o'clock that we need to get to, so.
That's correct. So we have some time to get that done, and I have some passengers to take to their individual things with me on the way. Thank you. If there's no other items, this meeting's adjourned. Thank you. Thanks, Scott.